Well, hello. My name is Pamela Fess and I'm a registered nurse. Happy to be here. I'm here today to review the assessment and evaluation of a Picc line. A Picc line, by definition, is a peripherally inserted central catheter. And what you need to know in regards to that definition is peripheral means it's typically placed in the arm of your client. So therefore, your peripherally inserted central catheter, when you go in to render care and assess and evaluate the efficacy of this line, you will probably typically see the Picc line on your client's arm. So what you want to look for first and foremost is any signs and symptoms of infection. You would enter your client's house or residence. You would ask them to expose their Picc line and assess the dressing for any redness, leaking, warmth. You would ask them if it hurt in any manner. Now, do not remove the dressing because the dressing is sterile. And if you remove the dressing, you would put that client at risk for infection, and you don't want to do that. So your role is to look at the dressing, make sure it's not wet, damp, it's not moist, because moistness breeds bacteria and you don't want that. You would ask your client if they're having any pain, and you would palpate around the site, of course, with gloves on. You want to don your gloves, and when you don your gloves, you would tell the individual, your client, that you are palpating. That's a fancy word for touching to see if there's any swelling as well. So now that I have my gloves on, go over to your client and lightly palpate and see if it feels squishy in any manner. And see if it's warm. You can use the back of your hand as well to assess that. So taking a look at that, you will be able to evaluate your Picc line. Another one of your responsibilities will be to flush the Picc line. In order for this patient to maintain patency, that means to keep the vein open, to keep the line free flowing, you will be responsible for flushing the Picc line with 0.9% saline, normal saline. Now, this is not a medication. This is the same type of physiological makeup that's in the veins and arteries of your body. 0.9% normal saline, of course, minus the blood cells. So you will be provided these. These are pre-filled syringes for you to administer to your client. In order to activate the syringe, you will need to pull back and then push up on the plunger. And you'll see a little bit of the fluid coming out. After you activate the syringe, your responsibility will be for you to clean the hub of the catheter. Now, your Picc line may have several hubs because there's several different types of Picc lines, and you may have 1, 2, or 3. Depending on whether it's multi-lumen or single lumen, you would flush them all. So the first thing you would want to do, again, you have your gloves on, you scrub for 10 seconds. So 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. And the friction is what cleans it. After you've done that, you want to place your syringe on the hub of the catheter, release the clamp, and pull back. Why are you pulling back? Because you're seeing whether or not you have blood return. You want to assess for blood return. Blood return indicates that it's in the right spot. It's in the vascular system. And then you want to push, pause, push, pause, push, pause, push, pause very lightly and administer all that medication until it's all gone. If you meet resistance, do not proceed. If you do not have blood return, do not proceed. Call your provider, because if that were to occur, there would be further assessment and evaluation of the patency of the Picc line. After you've administered all the saline solution, you clamp the catheter again and you dispose of your sharps in a sharps container that you were provided. In conclusion, I'd like to go over the salient points. You're there to assess for infection. Signs and symptoms of infection are redness, warmth, edema, swelling, or the client indicating they have pain. You're also responsible for keeping the line open, patent. and that you would do by flushing with 0.9% normal saline. Again, if you don't have blood return, always pull back for blood return before you flush. If there's not blood return, don't proceed. If you have resistance with flushing, do not proceed and call your provider. Hopefully this will give you the right information you need to secure good, safe health care for your client.